Hello friends, myself Dr. Akhilesh, your physiology faculty. In this video, I will discuss the another 10 questions from the reproductive system. In my first video, I have recorded from question number 1 to 10. So to watch that questions, you can visit my first video of the physiology of reproductive system. So coming to this video, question number 11. So remember, from question number 1 to 10, I have discussed in my previous video of the MCQs on reproductive system. So question number 11, true about Turner syndrome is option A, bar bodies are present. So this statement is wrong about the Turner syndrome. What is bar body? So bar bodies are the extra X chromosome. Besides one X chromosome, they condense to form the bar bodies. And the bar bodies are calculated by using the formula n minus 1, where n is number of X chromosomes. So in the case of Turner syndrome, the karyotype is 45XO. So here there is one X chromosome. So therefore the bar bodies in the Turner syndrome will be 1 minus 1, that is 0. So bar bodies are not present in the Turner syndrome. Option B, the karyotype is 45XO. Yes, it is true about the Turner syndrome. Option C, low FSH level. Yes, it is false regarding the Turner syndrome, because in Turner syndrome the FSH level is high because of the low inhibin level. So in Turner syndrome, inhibin level is low, so therefore the inhibition of FSH is not there. So FSH level will be high. The normal breast, this is also wrong, because in the Turner syndrome there is flat shield shaped chest. Here the breast is not developed normally. Then question number 12, true about Turner syndrome is option A, normal breast. This is wrong, because just in the previous question I told that the breast is not developed and the chest is flat shield shaped. Then regarding the option B, normal gonads, this is also wrong, because in the Turner syndrome there is gonadal dysgenesis. So this option is also wrong. Intelligence is normal. Yes, it is true. The intelligence is normal in the Turner syndrome. Option D, long stature. This is wrong, because in the Turner syndrome the individual has the short stature. But yes, of course, not dwarf. So the true about the Turner syndrome is option C, that is normal intelligence. Question number 13, the karyotype in testicular feminizing syndrome is the testicular feminizing syndrome. This is also called as androgen insensitivity syndrome. It is also called as androgen resistance syndrome. And the karyotype in this syndrome is 46XY. So the correct answer is option number C, that is 46XY. Question number 14. Which of the following condition presents with absence of both Mullerian duct and the Wolffian duct? So both Mullerian duct and Wolffian duct, they are absent in the androgen insensitivity syndrome, also called as the androgen resistance syndrome, also called as testicular feminizing syndrome. So in this condition, the Mullerian duct as well as the Wolffian duct, they are absent. Question number 15. All of the following statements about androgen insensitivity syndrome are true except we have to find out the false statement. Option A, 46XY karyotype, this statement is true because the karyotype is 46XY in the androgen insensitivity syndrome. Option B, abundant pubic hair, this option is wrong because the pubic hairs in the androgen insensitivity syndrome, it is scanty or it is absent. So this option B is wrong. Option C, short vagina, this is true because the upper vagina, fallopian tube, uterus, they are absent and the vagina is, there is short vaginal pouch. So this option is right. Regarding the option D, ovaries are absent. This is also true because in the androgen insensitivity syndrome, the testes are present in the inguinal canal. So the false statement regarding the androgen insensitivity syndrome is option B, that is abundant pubic hair. Question number 16. Primary amenorrhea with normal ovaries, normal external genitalia and normal breast are seen in. So in this question, we have to find out which condition is normal ovaries, normal external genitalia and normal breast with primary amenorrhea. So option A, this is the right one because in the Mayer-Rokitansky-Kuster-Hauser syndrome, there is primary amenorrhea with normal ovaries, with normal external genitalia and normal breast. Regarding Turner syndrome, the Turner syndrome, it will also present with the primary amenorrhea, but the ovaries are not normal and the breast is also not developed. So there will be flat, shield shaped chest and external genitalia are also not well developed. In the option C, that is androgen insensitivity syndrome, there are the testes, not ovaries. So here testes are present. It also presents with the primary amenorrhea. In this case also the breasts are normal, but the ovaries are not there. Instead of ovaries there is testes. The Noonan syndrome, this is the male version of the Turner syndrome. So this option is also wrong. So the correct answer is option A, that is Mayer-Rokitansky-Kuster-Hauser syndrome. Question number 17. A patient with karyotype 46XX presents with primary amenorrhea. The secondary sexual characteristics are normal. FSH, LH are within normal limit. Ultrasonography ovaries are present, but uterus is absent. The patient is having. So these features mentioned are present in the Mayer-Rokitansky-Kuster-Hauser syndrome. Regarding the option B, androgen insensitivity syndrome, the karyotype is 46XY and here the testes are present. So this option is not right. The Turner syndrome, the karyotype is 45XO and the ovaries are present but uterus is also present here. The uterus is also present here, and here the FSH and LH level are more than normal. Noonan syndrome, this is the male version of Turner syndrome. So this option is also wrong. So the correct answer here is option A, that is Meyer-Rokitansky-Kuster-Hauser syndrome. Question number 18. A 19-year-old female comes to gynae OPD with complaints of primary amenorrhea. On examination, breast was well developed. Female external genitalia was normal. Pubic hairs were also normally developed, but vagina was blind. Ultrasonography, ovaries were present and normal, but uterus was absent. The most likely diagnosis is. So here the answer is the Mullerian agenesis, also called as Meyer-Rokitansky-Kuster-Hauser syndrome. So in this syndrome or Mullerian agenesis, the above mentioned features are present. Regarding the option A, Turner syndrome, the Turner syndrome will also present with the primary amenorrhea, but breast is not developed. And ovaries are not normal. So there are streaked, fibrosed ovaries, and uterus is present. So this option A is wrong. Testicular feminizing syndrome, here the primary amenorrhea is there, breast is also normal, and female external genitalia is also there, but pubic hairs are scanty or absent. The pubic hair is scanty or absent. And instead of ovaries, there are testes present in the inguinal canal, which can be revealed by the ultrasonography. So ultrasonography will reveal testes instead of the ovaries. So this option is also wrong. Gonadal dysgenesis, this is also called as the ovarian dysgenesis. This is also called as the Turner's syndrome, which I have mentioned in the option A. So the correct answer is option C, that is the Mullerian agenesis. Question number 19. Testosterone is produced mainly by. So it is produced mainly by the interstitial cells of Leydig. In the testis. So the answer here is option A, that is the Leydig cells. Question number 20. Mullerian inhibiting substance MIS is produced by. So MIS, Mullerian inhibiting substance, is produced by the Sertoli cells. So Sertoli cells, it produces the Mullerian inhibiting substance. It produces the hormone inhibin B. It produces androgen binding protein. It also produces activin. So these are the hormones or substances produced by the Sertoli cell. So thank you for watching this video, and we will present the remaining questions in the next video. So thank you very much for watching this video.